This portion of New Day Northwest is sponsored by Stryker Orthopaedics.
Welcome back to New Day. Many people think that hip replacement is something only older people need, but the surprising reality is that more and more young and active people are having to consider hip replacement for a variety of reasons. Joining me today is Dr. Stephen Teeney from Puget Sound Orthopaedics to talk about a new mobile bearing hip solution that can benefit these patients. I often say I'm not a doctor, but I play one on TV. You are an actual doctor. This is going to be fun for me to find out what the real thing is.
Very nice to be here.
So we were just talking about backstage the fact that younger and younger people are having hip replacements. Why is that?
Well, a lot of people are a lot more active these days than they've been in the past, doing a lot of sports, a lot of high-impacting activities. Sometimes there's injuries. So they're exposed to more reasons to have their hips wear out.
And in fact, people around our office knew people both in their 20s and their 40s who were doing this now, which was a surprise to me. So tell me about the new technology and why this makes such a difference.
Okay, well, we have here a hip replacement. This is...
I've never gotten to see one of these. Have you ever seen this?
Would you like to hold it?
Yes, I would like to hold it.
Okay. You can see it has two parts. The upper part here is called the socket. That's what we put into the pelvis bone. And the lower piece here is called the stem, and that goes into the thigh bone. And the ball is this area too, right here. And what's unique about this is it is a sort of a ball within a ball. We call it a mobile bearing. It allows it to rotate and bend at two spots instead, one here and one here. By dividing it up like this, we can gain a little bit more range of motion and hopefully improve the wear so that it actually lasts longer. That's what the big advantage of something like this is.
How long would it last?
Well, you know, it's we hope it's going to last a lifetime for a patient, and hopefully, even if it's something is needed done in the future, we have ways to continue to take care of it.
We have a little bit of animation that helps us understand the difference between old and new technology. So let's take a look at that, and if you could explain what we're looking at, that'd be great.
Here again is the socket. And this is the liner made of plastic, and here's the stem that goes down in the middle of the ball, or the middle of the bone, and then the ball that's right here. And you can see that it's bending right at this location here, has a range of motion, we say from about here to here. So this is when a person walks or bends their hips, this is about how far it can go.
All right.
That's still quite a bit, 138 degrees.
But if we move to the next animation, which is the mobile bearing, then we get an idea of what's different about that and the improvement that we get with that. So let's take a look at that and see, as you mentioned, it bends in so many more places, or at least two more places that we can actually figure out how this is going to...
more range of motion and more stability. It's a bigger ball. It's harder to come out of socket. So once we put it in there, we want it to be real stable so that a person can move around and have less likely chance of it coming out of place.
Okay,
so
we're going to try to get a look at that in just one moment. They'll let me know when that's ready. But tell me, in terms of patients who are having this now, is there any difference in terms of their recovery time or anything else that happens with them, or is it just very simply that mechanically this is better for us as we get our hips
in
replaced?
this particular situation, it's the mechanics, it's the technology and the actual implant and materials that make this a better hip. The materials that the plastic are made out of are designed to last a long time, be able to bend it many times, even better than what we've had in the past. And the real shiny, polished surface of the socket doesn't scratch well or much at all, so that hip will last a long time.
It's actually quite attractive, but you won't be able to show it off.
It'll be inside you.
Okay, so we are going to take a look at the other piece of animation. Now, this is the mobile bearing.
Right. And you can see that actually there's a liner. This bends and it bends here.
Just like
so
you
it goes
showed
out
us.
more like 145 degrees. So there's even more range of motion in this hip. And the idea is that by having most of the motion here and some here, this is actually a good surface to have it bend at. And when we need a little bit more, we can use the outer bearing surface.
I can certainly see why that would work. Now, how do we know if we're having difficulty? I used to be a runner. I'm not anymore. But, you know, when you have hip pain, sometimes it's hard to know, is this serious? Will this go away? I sort of had Advil as my breakfast of champions every day. And, you know, when do you know you need to seek out some medical help?
Right. Well, you start with the usual things. You know, rest a little bit, relax a little bit, try not to do quite as much, see if it goes away. If it goes away, maybe you're okay, or take a little Advil, and if it doesn't If that goes away, then you're fine. But if it persists, particularly in pain like in your groin or your front of your thigh, your buttock region after you've taken that Advil and still stays around and is stopping you from doing the things that you'd like to do, then that would be the time you want to go see your physician, your orthopedic surgeon.
It sounds like good advice, and it's wonderful. Technology is changing our lives in so many ways, but this idea that we can actually fix something like this and you can return to an active, healthy life is amazing.
It is exciting.
It's amazing. Thank you so much for joining us. It was lovely to have you here. We'll have more information. We'll have more information about Stryker's new mobile bearing hip option on our website at king5.com/new day. So if you think you might need something like this or somebody in your family, please check out the information. And when we come back, a local website devoted to